COVID-19 caused by the coronavirus has led to a pandemic that threatens everyone. The situation is particularly perilous in the Philippines, where approximately 402,000 people were infected and more than 7,000 people were recorded dead. The Philippines is also now second in Southeast Asia's COVID-19 count and one of the top 20 countries who are greatly affected by the said virus. So what can we do in order to slow down the spread of the virus? And what can we learn from other countries who were able to do this?
The overriding strategy to limit the damage and to beat this pandemic is to flatten the curve.
An epidemic curve is a chart used to display the occurrence and speed of new disease cases. The overall shape of the curve can reveal the type of outbreak we're dealing with, and the horizontal line represents the capacity of community healthcare system.
Hospital capacity is defined as the number of beds, staffing, and other measures available for patient care. Now, most hospitals in the Philippines and many other countries are operating on the capacity line. That is why in this pandemic, the infectious agent spreads very rapidly, causing the curve to rise and cross the line. With this, the healthcare system can no longer meet the needs of COVID-19 patients as well as all the other types of patients. That is why at this point, people are not getting the best care and outcomes as the mortality rates start to rise quickly.
However, a large number of lives can be saved by simply ensuring people get sick at a slower rate. This is called flattening the epidemic curve. A flatter curve assumes the same number of people ultimately get infected, but over a longer period of time, which leads to a less overwhelmed healthcare system.
One of the examples of this is our neighboring country, which is South Korea. After seeing an initial spike in COVID-19 infections in February, South Korea implemented several measures to bring the disease's spread under control. South Korea was able to lower the number of new infections from 851 on March 3rd to 22 infections as of April 17, and the mortality rate from COVID-19 hovers around 2%.
Another is Thailand. Thailand reported the first cases of COVID-19 on the 13th of January 2020. Cases were few initially, but by mid-March, the situation started to escalate. But Thailand imposed strict rules in their community and lifted more restrictions like the curfew and alcohol ban. And now, the government reported 0 new coronavirus cases and no new deaths for 100 days in a row.
How did these things become possible? From these Asian countries, here are the key factors they've shared to flatten the curve. Social distancing, which refers to measures aimed at reducing close contact between people. This is why governments are closing schools, other businesses, places where people gather like sporting and social events, and even traveling is banned.
By limiting interactions between individuals, we can limit the spread of the disease. This is why it is so important to educate the people in our community as much as possible through news articles, online education, and even social media posts.
Apart from social distancing, there are a number of key behaviors that you can do to help, like practicing good hygiene by washing your hands properly, and sanitizing frequently touched objects and surfaces, as well as isolating in confirmed and suspected cases. Or if more possible, stay in your homes and avoid having contact with the people outside.